Welcome parents to the Summit Center Virtual Parent ABA Workshop. I'm Dr. Marcia Gregg, and we're going to be speaking a little bit about what is ABA and what is autism today. Watch while I share the PowerPoint. So we're happy that you're here with us today at the virtual workshop. A few housekeeping items for the live videos. We're going to ask you to turn your video on at all times. I'll introduce myself today, but hopefully I'll get to meet you in the next video, in the next meeting. And we're going to talk about intro to applied behavior analysis and what is autism. Please do not record audio or video of the workshop as you agreed to on the consent for offsite service. Parents who want unity, the primary parent must attend all of the workshop sessions. And in the live sessions, you can earn participation points for asking relevant questions and contributing to the discussion. And you can earn prizes. The people with the most points get the first choice of all the prizes. So I'm Dr. Marcia Gregg. There's my email. I'm the clinical director at the Summit Center, and I'm retired as a psychology professor at the University of Windsor. I've been working with people with autism since 1986, and I firmly believe that kids who get diagnosed at a younger age and then can get treatment at a younger age, which we know the most effective treatment is ABA. I also am very interested in parent training in ABA and a positive approach to treatment. So what is ABA? What is applied behavior analysis? People are going to ask you that. So ABA is a systematic method where we select the goals we're going to teach the child. We break each goal into tiny little steps, teach each step over and over again with a lot of repetition and a lot of positive reinforcement. We keep track of how much progress the child is making, and then we revise their program to make it more advanced if they're making a lot of progress in one goal, or to revise the program to make it easier if they're not making a lot of progress. And then for generalization, we teach the child to apply the skills in all settings, at home, at preschool, at circle time, at a table, and with all people, like their therapist, their teacher, their parents, their grandparents, or whatever. We use ABA with preschool children with autism because it has the strongest research support to show that it produces lasting improvement in children's skills and behavior. If you've heard of ESDM or the Early Start Denver model, that is ABA that's adapted for the youngest children, 12 months and up. And our executive director, Helene Hebert, is registered in Early Start Denver model. So when people ask you about ABA therapy, what is it? Think about Get a Cab, 7 dimensions, which we're going to go through one by one. So Get a Cab, G is for generality. As I mentioned, we want to teach the skills so that your child can do the skills in different places, like at the center and at home, with different people, like with their staff and with their parents, with different prompts, and that the child keeps doing the skills over time. Get a Cab, E is for effective. So we believe that you've got to show that the child's behavior changes by taking data to keep track of how successful the child is in different skills to show that the treatment is effective. Get a Cab, the T is for technological. So our technology with ABA, every child has a binder, all of their programs are written down, clearly described so that everyone can be consistent. The parents, the teachers, all the child's therapists on their team can teach the skills in the same way. Get a Cab. The A is for applied. We want to teach skills that mean something to the child, to their family, and society. We want to teach skills that improve the child's quality of life. Get a Cab. C is for conceptually systematic. Doesn't that sound complicated? So basically, ABA is research-based, and it firmly focuses on teaching individual behavioral goals or skills to fit in together to the bigger plan for the child's learning. Get a cab. A is analytic. So again, we use data, or we keep track of how successful the child is with different skills, so, keep track of the child's behavior, and then we decide on different treatment methods, strategies, based on the data. If the data shows the child's behavior skills are increasing, then we do more of the same. If it shows they're not, then it's our job to change the program so that the child's skills can increase. And B, behavioral, of course. ABA focuses on pragmatic behavior change to do three things. We can increase positive behaviors. Say your child says hi, but only says hi once a week, or only says hi to you, but not to anybody else. ABA can increase that behavior your child already has. ABA can also be used to decrease unwanted behaviors. So if your child pulls your hair, we can teach the child what to do instead. We can reinforce other behaviors that your child does instead of pulling your hair. So ABA can be used to decrease those behaviors that you don't want. And most importantly, ABA can be used to teach new behaviors. Say your child doesn't know how to match a picture to an object. The ABA can focus on teaching that. Say your child doesn't know how to say, I love mommy. ABA can focus on teaching that and many other skills. So I know that you'll have lots more time in this workshop about ABA, but that is a brief introduction. So now we're going to talk briefly about autism spectrum disorder. What is autism? So we really need two things in order to diagnose autism for a child. Number one is what I like to call sticky behavior. The child gets stuck on doing the same, perhaps motor activities over and over again, or saying the same words over and over again, or the same sensory routines over and over again, and kind of gets stuck on things. Children with autism also often have very intense interests. Say they are only interested in vacuum cleaners or only interested in African and Asian elephants. And children with autism often show unusual sensory behaviors. They may stare at lights, they may cover their eyes when it's sunny, they may scream to hear the echo in the room, or they may cover their ears at loud sounds. And the same with touch or smell. So sticky behavior is one category that we're looking for when we say, what is autism? The second category is social communication and interaction, which is weak in order to get a diagnosis. So that back and forth sharing of social and emotional times tends to be lower in kids with autism. Besides their verbal communication, children with autism also tend to have weak nonverbal communication. Pointing, gestures, body language, facial expression, both using those and understanding those can be harder for kids with autism. And children with autism often tend to have weaker relationships, especially with peers, than children the same age. I put anxiety over here off to the side. You don't need to have anxiety to be diagnosed with autism. And also, of course, lots of people who don't have autism also have anxiety. But about 2 out of every 3 children with autism shows high anxiety. So we want to add that there to make sure that we know that when we're working on improving the sticky behavior and the weak social communication skills, that we also work on alleviating the anxiety as well. So there are some associated features with autism that do occur much of the time, but you don't need for a diagnosis of autism. There are cognitive deficits, strengths, and weaknesses in many children with autism. 30 to 40% of children with autism have intellectual impairment, and even those who don't may often be much higher in some skills than in other skills. There's other associated features like motor features like walking on their toes or shaking their fingers, differences in eating, sleeping, and drinking, Paying attention may be different. Children with autism may focus very closely on something they're really interested in, but have difficulty shifting their attention to something else or to paying attention to things that other people might want them to pay attention to. Children with autism often have anxieties, as I mentioned, or fears. And there are medical conditions that go along with autism sometimes. Like, for example, about one out of every 4 children with autism also has seizures. So autism, as you probably know, is a spectrum disorder from children who are very, very delayed in their skills to children who are above average in their skills. And their autistic behaviors or autistic symptoms may range from very mild to very severe. And autism is developmental in that the children's abilities and symptoms can change with age, and with good programming can improve, especially during the preschool years. So what do we need to diagnose autism? We need standardized behavior ratings of the child, standardized parents' report of the child's behaviors, an extensive interview with the parents about the child's early developmental history. And in Ontario, the law says that a psychologist or a physician with training and experience can diagnose autism. So we can diagnose children at 24 months. About 80% of children with autism can be diagnosed by 24 months, and sometimes even younger, especially if the autism is more severe. So I hope you know that early diagnosis is a really good thing because it can lead to early intervention, which we know children have a better future the earlier that they start ABA. Parents also tell us that they prefer their children would have got diagnosed earlier. So just so the parents knew, not knowing can be the hardest thing, so that parents can connect to the autism community and so that they can access support for their families as well as for their child. So some red flags for autism. People should have an immediate evaluation if the child's not babbling by 12 months, not gesturing, and by 16 months, not saying single words, mom, bottle, and no 2-word phrases by 24 months, want cookie, more juice. And any time that a child loses language or social skills at any age, they should be referred for an autism evaluation. About 30% of children appear to show some regression or loss of skills. We know that we can see signs of autism, sometimes even by 12 months. You can see many signs there. One of the ones that I say, if you're going to remember one, think about orienting to name. Most children, even children with other types of delays, respond to their name by the time they're 6 months old. So if you call their name, they turn and look at you. Orienting to name is something that many, but not all children with autism are very delayed in doing. So that's a little bit about what is autism. You know how to get a hold of us because you're here. You know that we have a YouTube channel and our Facebook page. I look forward to seeing you during the parent panel, and I hope you enjoy the rest of the workshop. All the best to you.